Hello everyone, let's continue. Sixth question. Patient on a long-term hemodialysis due to the renal failure is likely to develop which type of amyloidosis? Amyloidosis question is very important. Here there is a mnemonic. Can't tell this is a mnemonic, but the thing you have to remember is how many kidneys you have. 2, isn't it? So write this is kidney and write 2. And what is that? Beta 2 microglobulin. Amyloid beta 2 microglobulin. So easy, right? So chronic hemodialysis and renal problems, you can remember beta 2 microglobulin. L for light chain, which is the primary amyloidosis. This is also important thing you have to remember, where you can see in the multiple myeloma. Multiple myeloma is a primary amyloidosis, whereas AA is seen in the chronic inflammatory disorders or rheumatoid arthritis, which are the secondary amyloidosis. Whereas AA or A Pyrin. What is pyrin? Pyrexia. That is fever, right? Familial Mediterranean fever. Whereas ATTR is for cardiac or senile amyloidosis or familial amyloidotic polyneuropathy. TTR is nothing but transthyretin. Okay. In cardiac amyloidosis, they will give a history of restrictive cardiomyopathy, and which type of amyloidosis is seen, then you have to mark ATTR. Okay. This other amyloidosis we will teach in 20th notebook. Okay, 7th one. Transbronchial biopsy of a patient with a fever, cough, and weight loss shows the findings of the biopsy below. Which of the following chemical mediator are involved in this pathogenesis? What is this? Fever, weight loss is the symptoms of TB. This is the caseating granuloma. What is the chemical mediator involved? That is interferon gamma. Okay. Granuloma, G for G. What is that? Interferon gamma. Okay. The picture is the of a granuloma. The important cytokines for the formation of granuloma is interferon gamma, interleukin 12. What these chemical mediators do? They will activate the macrophages, which differentiates into the epithelioid cells and then multinucleated giant cell. These are the epithelioid cell. This again will coalesce together to form the multinucleated giant cell. What type of hypersensitivity is seen in the granuloma? That is delayed type, that is type 4. Other options, the bradykinin is a vasodilator which is involved in the inflammatory response, not in the granuloma. Whereas complement C5a is a chemoattractant which attracts the neutrophils and other inflammatory cells to the infection site. Okay. Whereas prostaglandin, important thing, that is a group of signaling molecules that are involved in variety of physiological processes including inflammation. The prostaglandin can promote or inhibit the formation of granuloma depending on the context. Okay, it has a both stimulant and inhibition effect also. But here the granuloma G for G, that is interferon gamma. Yes. What is this? Electron microscopic image is given. Identify the cell. What is this? These are the hairy cell. What is this? Fine hair-like projection in the electron microscope is the hairy cell, which is seen in the hairy cell leukemia. Can you tell the key points of hairy cell leukemia? That is BRAF V600E mutation. We have already learnt BRAF V600E mutation is seen in Langerhans cells histiocytosis. Massive splenomegaly is seen. Yes. Can you tell me massive splenomegaly causes? We will discuss in the 20th book. If you know, please comment. Markers are annexin A1, which is important. Where you can see the another annexin. This also we will discuss in 20th book. Okay. CD25, CD11C, CD103 plus. When you do the bone marrow aspiration, there will be dry tap. Bone marrow biopsy, you can see fried egg honeycomb appearance. The fried egg in pathology. Can you tell? Again, we will see in the 20th book fried egg. Special strain is trap positive, that is tartrate resistant acid phosphatase positive. The other thing was given is target cell, where all you can see the target cell thalassemia, hepatic disease with jaundice, hemoglobin C disorder, post splenectomy state. Okay, whereas in Gaucher's disease, you can see crumpled tissue paper appearance of the cells, which is a acid beta glucosidase deficiency, and which comes in the lysosomal storage disorder. This is very very important in biochem. Okay, sickle cell, already third time we are hearing the sickle cell disease, sickle cell anemia, which is the autosomal recessive. Okay, eighth one done. Ninth one, 28-year-old female presenting with 36 weeks of gestation underwent C-section for placenta accreta spectrum. During the procedure, there was a profuse bleeding. She was transfused blood according to the massive blood transfusion protocol. Which of the following is not seen after massive blood transfusion? Okay, they are telling which of the following is not seen. Hypomagnesemia, hypokalemia, hypocalcemia, and hypothermia. Let me show you the answer. Massive blood transfusion, you have to remember this. Okay, when you give more than 5 to 10 units of RBCs within 24 hours actually, or you transfuse the 50% of the patient total body volume over 3 hours. Okay, what are the complications? You have to remember catch here, which because of the more blood you have transfused, there will be dilutional coagulopathy. What is that? The large volume of fluid and blood replacement can dilute the blood's natural clotting factor, okay, and platelet, making it harder to stop the bleeding. Okay, what is consumption of the clotting factor? The body's response to the major bleeding involves there is continuous activation of the coagulation system, which consumes the platelet and clotting factor faster than they can be replaced. Okay, the body will activate their system clotting system so fast that even though if you transfuse also, it's very difficult for us to replace. Then you can see the acidosis or alkalosis, it depends. And hypothermia is seen because when you rapidly transfuse the blood component at 4 degrees Celsius. Citrate toxicity is because of which is present in the blood bag or the anticoagulation. This citrate will chelate with the calcium and magnesium, hence there will be hypocalcemia and hypomagnesemia. Okay, the calcium and magnesium level will be reduced in the blood. But hyperkalemia is seen. Why? Because when you store the blood for a longer time, there will be potassium leak from the RBCs. Hence, there will be hyperkalemia, not hypokalemia. So, patient might complain of arrhythmia. Hypocalcemia, we have seen. Yes. What is the treatment? You have to give insulin. Insulin will make the potassium to go inside the cell. Hence, the potassium level in the blood will decrease. The glucose you have to give because you are giving the insulin. Calcium gluconate to replace hypocalcemia and volume overload. Hence, you have to give furosemide. Okay. Hence, hypokalemia is not seen. Other things are seen. 10th question. Which of the following are true about the amyloidosis? This is the second time we are seeing about the amyloidosis. Just we have started the patho question paper. Already we are seeing some of the words familiar, isn't it? It is an extracellular protein. Yes, of course it is an extracellular protein. It is called amyloid because of starch deposit. Yes, it is because of starch deposit. Yes. Beta pleated sheets are seen on X-ray crystallography. Yes, correct. AL is the secondary type of amyloid. Do you remember? L I have marked. What is that? It is a primary. So I know fourth one is obviously wrong, which is a light chain which is seen in the multiple myeloma. Do you remember? Yes. So fourth one is obviously wrong. So which is the answer? C. Isn't it? Yes. If you have not known this three also was not an issue because we know fourth one is wrong. Isn't it? This is the art of solving the MCQs. Yes. See. AL light chain multiple myeloma. Yes. Amyloidosis is what? Is a proteinaceous. It is a proteinaceous extracellular homogeneous pink deposits. Where it is deposited in the extracellular. Why it is amyloid? Starch deposits. Electron microscope shows there is non-branching fibrils. But here they have given X-ray crystallography in the options. What is it? Cross beta plated sheet, which shows a apple green bifringence on polarizing lens. Okay. AA is the secondary amyloidosis, which is seen in chronic inflammatory disorders like rheumatoid arthritis. Okay. Thank you. We have completed 10 questions. I think it's more than enough for today. We will discuss few more questions in the next class. Okay. Don't get overwhelmed. Learning slow is not an issue. Okay. You can learn slowly. Learning slowly will help you. Okay. Slow and steady will win the race. Thank you.